Okay. Good morning, everyone, and I hope everybody in your families had a great Easter yesterday. Before we start, I'd like to take a moment of silence for my Chief of Staff's, Tommy Ash's mom, Mary Ash, who passed away this weekend. Wonderful lady, very caring and kind, and had those beautiful twinkling eyes. We're so sorry for the loss. So a moment of silence for Mrs. Mary Ash. Thank you very much. I'll tell you what, it was good to see school buses on the road and crossing guards out there as we start to get back to school. I want to again thank Dr. Robert Roos, Chief Medical Officer of Mercy Hospital, Trinity Healthcare, and Dr. Mark Kerouac, CEO and President of Bay State Health Systems. I know he's on his way. They're an integral part, very important part of these continued briefings, and the partnership is deeply appreciated. I'd also like to thank the media, again, for your partnership in getting information out to TV, radio, and print media. Thank you very much. And Focus Springfield, who has been unyielding in making sure we continue to get information out and hold public meetings. So thank you to the Focus Springfield crew. Of course, to our sign language professionals, thank you very much. Great glasses today, too. I like those glasses for being here. To my cabinet heads and rank and file, again, tested and true through a number of natural and man-made disasters, and their families. Thank you very much. And of course, to you, the viewing or listening or reading audience here, the residents and business community of the City of Springfield. Thank you for your continued patience and understanding and cooperation as we move to defeat this COVID-19. Commissioner Carlton Harris on the updates, and she'll speak of it too. We did sense the last few weeks with the uptick, there seems to be a little bit of, with the reopening, etc., a little bit of lax. People are getting a little lax out there. I do notice more and more people not wearing masks, and we still have to stay ever vigilant. And businesses need to follow all the COVID-19 public health regulations and guidance. We continue to do that, and we defeat this COVID-19, that's when you'll bring full business, consumer, and public confidence back. So it is a balancing act. We are still technically in the red. We want to work hard to get back down in the yellow and eventually to green. With that, COVID-19 confirmed total cases has risen to 19,815 since this surreal ordeal has started. The monthly number is 1,770. The weekly number was 486. I also want to thank the residents and business community, your patience. City Clerk's office had to be closed last week and deep cleaned and quarantined. City Clerk's office is back reopened. So I'll say again, the City Clerk's office is back reopened. And again, appreciate the patience. Vax Force meetings will continue. We have one this week, but Mr. Carlton Harris will probably speak of that as we gear with the subcommittee of the religious subcommittee. Interfaith will be meeting, and we've set up an interfaith vaccination day. Commissioner Carlton Harris will speak of that. That's important because many times people will listen to their pastors and their priests, their imams, their rabbis. So that's important about getting vaccinated. Helen and I are continuing our efforts to open up neighborhood vaccine locations throughout the city. So stay tuned on that. We based on facts and the underserved populations in the city of Springfield. Many times it's the brown and black population. And as soon as we continue to get more vaccines, whether from the federal level down to Governor Baker, he's indicated he will continue to get them to the city of Springfield to me, Helen and I, so stay tuned for more neighborhood vaccination sites to be opening throughout the city. Homebound residents that need the vaccine shot, homebound. A program is being run, Governor Baker through the state, and that information is already out there. So you have the contact, the state, the vendor that's running that, and they will come to your home for homebound residents that are in need. We continue to assist our Springfield residents with our telephone banks to set up appointments, and I want to thank the Health and Human Services, the Elder Affairs Division, my Library Division. They've been fantastic in helping whether seniors or any others who are having trouble traversing for the appointments. We continue to deliver meals to our senior citizens who are homebound. Stop the spread testing continues with our great partner, AMR, Patrick Leonardo, Director of Operations, is here, and that's up at the Eastfield Mall. And the mass vaccination site, Curative at the Eastfield Mall, continues, and that's going very smoothly. Stay tuned that there'll be an announcement pertaining to the Oasis food pantry. Again, with schools coming back in session, that will be moving away from Central High School. I know we service about 3,500 families. They'll be going to a large area in the city. And I want to thank to Food Bank of Western Massachusetts, to John Foley, Oasis Food Pantry, Tedesco, who's been a great partner in my city departments on that. Unfortunately, we had 7 new deaths that have occurred due to COVID-19. That brings the total of Springfield residents who have passed to 239. And again, my administration's sympathy, thoughts, prayers, and encouragement go out to the families that have been affected. Of that, the new tally is 98 white, which is about 41%, 52 black, which is about 21.7%, Hispanic is 82, which is about 34.3%, Asian is 7, which is 2.9%. Long-term care facilities has really stayed stagnant status quo, which is great. 60, which is about 21.5%. Residential deaths are 179, which is about 74.9%. And some updates before I go to brief cabinet head updates. I met with Congressman Neal, Chairman Neal Ritchie, last week personally in his office, and we went over some specifics on the federal stimulus relief package, American relief package, and also the upcoming transportation infrastructure bill. The Congressman and I will be making some announcements as early as this week, and I'm deeply appreciative of Congressman Neal's leadership efforts to bring this money here to the city of Springfield. Over the weekend, C3 Policing, under the leadership of Commissioner Clapper, partnered once again in Mason Square and at Forest Park. The Elks Lodge, we did the bunny hops, the car parades, and I want to thank at the Forest Park one, Attorney Neil Phillips at Springfield Together, many Springfield teachers out of White Street School, Kensington Avenue School, and the Elks, and we gave away numerous Easter candies. And I'll tell you what, the teachers indicated the transition week prior went very well in our schools, and the students were excited. They can't see their teachers, they can't wait to get back in school. My assistant, Coach LeVar Glick, represented me at Mason Square while I was at the Forest Park C3. So that went well. It was very very goodwill. Unicare, David Morales, who I've known from the days of Governor Deval Patrick. He had come to see me about a year ago and wants to give back to the community. He's a man of his word. He facilitated $10,000 donation, which was after the Springfield Boys and Girls Club on Carew Street. And I was with my Chief Diversity Officer, Inclusion Officer, Attorney Tilia G., who grew up in the Boys and Girls Club, former chairwoman of the board and longtime board member. So that was very, very good. We had a meeting with MGM as we gear up entertainment coming back to Symphony Hall and the Mass Mutual Center with CEO, and President Chris Kelly and my team last week. We had an Autism Awareness Day. That was really a heartfelt event. We do it every year with Sunshine Village and Lisa Poultry. And we have some new pictures of paintings that the kids did for me downstairs as you enter City Hall with our blue light. And it was very well. I'll be meeting once again with the Pastors Council, as I've done before, and our continued proactive efforts to not only knock down this gang and gun violence with public safety officials, but just as important, with advocates and our Pastors Council, so that'll be coming up. Working very closely with that with City Council President Marcus Williams and City Council Marlo Brown and State Rep Bud Williams. Also met with the South End Citizens Council, Leo Forian, and Jeb Belize, the President and CEO of Belize Auto Sales, who has made a massive $10 million investment. Looks fantastic down there on updates to the South End Citizens Council. As we continue to work all angles to knock down this gun and gang violence, I'll be meeting again with Francine Brown. Francine does a good job with Families Against Violence, and I'll be meeting with her, multifaceted approach to continue to knock this down, besides with our police department and our state police partners. And continuing that note, Helen and I will be meeting with Brother Johnny Verdon of the Mission, and that is our street outreach to quell this type of activity. And then finally, we'll have a Flag Day raising for Organ Donation Month. I know that's near and dear to many here, including myself. I'm registered and I'm licensed too. That people, for whatever reason, lost their lives, their organs can be used to save other people's lives. So that'll be coming up this week at City Hall. On the police update, Commissioner Clapper indicates to me on COVID-19, she is down 8 officers. Knock on wood, it was a quiet weekend. We did have that meeting with state police commanders last week and partnering with the Springfield Police Department to continue to knock down the gang and gun situation. It was a quiet weekend. A couple of DOJ meetings continued this week as we start to forge an agreement. Also, we had a great academy graduation and promotions at Symphony Hall, and we brought on 31 new officers. Very diverse class. Again, Springfield Police Department and the Springfield Fire Department. Most diverse, obviously, in the Commonwealth. We're at parity, not only rank and file, but in leadership, but I think in New England. And we had some great promotions, and it really hit home to me when one of the newly minted sergeants, and many of those promotions came out of Central High School graduates, my alma mater, the High School of Commerce graduates, Old Cathedral and Classical, but one of the sergeants indicated to me, Mayor, you gave me my high school diploma from Central at Symphony Hall. When I graduated from the academy, you congratulated me here at Symphony Hall. And now in promotion through Commissioner Clapper to sergeant at Symphony Hall, and he said, I hope that you're here when I become a lieutenant. I said, I'm hopeful and I plan on being so. But really homegrown individuals, and that's important. because they know all in our community and respect all in our community. Fire, Commissioner Calvi, nobody down in COVID, which is fantastic. It's a quiet weekend. They did have that Lexington Street fire late last Thursday. A firefighter was hurt falling off a ladder on a car and injured his hip, and we wish him a speedy recovery. DPW Director Chris Signoli indicates to me one is down with COVID. 311, please call for potholes. We have our pothole units that are out there. Yard waste has started last week. Street sweepers are out there. Director Signoli is still in need of CDL licensed drivers and also needs traffic light technicians. Construction season is in full swing. Saturday I was by the Central Street, Hickory Street, Rifle Street area, and you can see by Ruth Elizabeth the traffic reconfiguration is starting to occur. On schools, Superintendent Warwick indicates to me we'll go over 7 million, I think, obviously, next couple of days. 6,920,409 meals have been served. Breakfast, lunch, dinner. Over the weekend, about 50,000 shortened weekend. We will continue, Superintendent Warwick will update you, we will continue 11 sites while schools are open from 4 to 6. So families are able to get their meals in the afternoon, 4 to 6 p.m. Schools have reopened so far, knock on wood, good. Hybrid started early this morning. The busing situation, I want to thank Superintendent Warwick and Pat Roach, first student. We worked all weekend to make sure that they had a number of the proper drivers, and that seemed to have gone good. We had a great Chapter 74 Putnam Vocational Technical Academy meeting, school committee meeting last Thursday evening. It was really uplifting. The video presentation they made, we thought they sent it out to have professionally done. It was the students and instructors. In Putnam Vocational Technical Academy, another first, the only tech school in the Commonwealth that was able to run the nighttime program, which has sci-tech students going to class on vocational technical aspects in the evening. We'll continue sort of back to the future. We used to do that with the old Putnam and trade, the only one, but it was very impressive. We have another school committee meeting, regular school committee meeting this Thursday evening. Finance, my CFO, TJ Plant, indicates to me since this has started, deficit is $8.5 million. We're running around deficit of FY21 about $4 million. Total money spent in deficit and grants is $35.4 million. Of that, been able to pawn off $26.9 million in grants, and again 8.5 deficit spending for the residents in the business community of the city of Springfield. And as stated prior, I'll go after every dime I get my hands on for reimbursement for the residents and the business community. Our budget hearings, my budget hearings will start tomorrow. As we review the budget, we continue to review the federal stimulus relief program coming from the federal package. Facilities and Parks, Director Pat Sullivan, nobody down with COVID-19. The golf courses have opened. Pat continues to work very closely with Commissioner Helen Fulton Harris as we continue to scout out neighborhood vaccine sites and expansion of shots to come. School reopening has gone well. We're going to do the lifeguard training. Our plans are to open up pools and waterways as we move forward. So lifeguard training will be announced very shortly. Spoke with Sheriff Kochi yesterday. Happy to say I know my daughters Cassandra and Kiara, my goddaughter Giovanna. I took a walk in the park early yesterday morning, all around duck ponds. Beautiful park, looks fantastic. And those deputy sheriffs, the park patrols are out there, and that's fantastic, and we appreciate that. Echo Dev, Director, CEO, Chief Development Officer Tim Sheen indicates to me nobody is down with COVID-19. We continue to review the federal and stimulus relief package. We had a good update meeting on 31 Elm Court Street, economic development project going on there with the principals. Technical assistance, Tim and I said we're going to continue to do this. Technical assistance, which is sorely needed for a small business. The RFP is out there. It is out there. Also, myself, Tim Sheehan, and my Chief Diversity Inclusion Officer, Tulia G, were part of the Economic Development Council, EDC, Anchor Institution Initiative, in terms where they're going to really press the buy local and hire local, especially a diverse workforce. Law, HR, and Labor, City Solicitor Pakula and Attorney Bill Mahoney. Attorney Mahoney indicates to me the United States unemployment rate is down to 6%. Eddie and I, we continue our DOJ meetings with Commissioner Clapwood and Judge Island DOJ officials. The reviews will start very shortly with the internal cannabis, marijuana RFPs as we move forward on the second round. With that, I will turn it over to Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare. He will give an update. I think he might be giving an update for Dr. Kerouac too, who I know is trying to get here. And at that time, when he is done or they are done, as we usually do, they will take questions at that point in time so they can get back to their important duties at their respective hospitals. Without further ado, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, Dr. Robert Roos. Thank you.
Good morning, everyone, and thank you, Mayor, for your continued leadership and in hosting these forums for us to communicate. I have spoken to Dr. Kerouac, and I will be providing an update from Bay State Health and their numbers this morning as well. I also would just like to share my condolences for the Ash family for their loss. I hope that everyone that celebrates had a wonderful Easter yesterday, and everyone was able to enjoy the weekend and get outside and enjoy some of the sun and the warmer weather in a safe way. The meaning of Easter and the coming of spring are both about hope. And I do believe that there is great reason for hope at this time, but it's not a magical hope or a fleeting hope. It's a hope that comes from a real belief in people doing the right thing and real fact that's rooted in science. The pandemic is not over. COVID is still here, and it threatens life and societies and economies all across the globe. I was struck actually by the Easter message from Pope Francis yesterday, where he stated that there is no mirage or magic formula, nor an immediate escape to the difficult situation we are experiencing. And that, quote, everyone, especially the most vulnerable amongst us, requires assistance and has the right to have access to necessary care. And that includes vaccines, which he noted are, quote, an essential tool in this fight. In terms of summarizing where we are, I couldn't have said it better myself. We're at a point now where global infections are rising, where there is inequity in terms of outcomes and access, and there still could be darker days ahead of us in certain hotspots in the country and across the globe. But notwithstanding that, there is also a great evidence-based, as I would call it, hope that remains in the form of vaccination and our race to community immunity. I'm going to talk about both of those things this morning. As of today, there's been more than 131 million confirmed coronavirus infections across the globe, with over 2.85 million deaths. Cases are still rising pretty rapidly in several large countries, including India, where there was more than 100,000 infections yesterday, Brazil, France, Turkey, Germany, Argentina, and they're rising here in the United States. Europe is seeing the institution of new curfews and some restrictions. And here in the United States, we've now had over 30.7 million cases, 554,000 deaths, and cases are rising in certain states, predominantly located in the Midwest, like Michigan, where they saw over 8,400 new cases yesterday, in Minnesota, as well as here in the Northeast, New York, New Jersey, Pennsylvania, Delaware, Rhode Island, Connecticut, and here in Massachusetts. The 7-day average of new infections across the country has risen by about 18 to 19% over the last 2 weeks, from about 55,000 to about 65,000 per day. Hospitalizations, however, which tend to be a little bit of a lagging indicator of trouble, have remained pretty flat, while deaths have continued to drop slowly and steadily by about 20% over the past 2 weeks. In Massachusetts, there have now been reported over 605,000 cases and nearly 17,000 deaths. Cases have also been rising over the past couple of weeks. And there was a few days this past week where the 7-day average of new infections per day was over 2,000 per day, which was much higher than the recent low of about 1,100. Test positivity has crept up to 2.4%. It's been pretty similar to what it was last week, but hospitalizations have started to increase. They were at 707 today, which was up pretty significantly from a fairly recent low of about 600. Although the deaths do still continue to decline, which is quite a positive thing. They remain about 25 per day. And it may sound good because that's quite lower than what it was a year ago or at other points during the pandemic, but that's still 25 deaths from a virus that now we've been battling for a year, every single day here in the Commonwealth, which is still pretty troubling to me. To me, there's a couple of important points to make when looking at the data trends across the country and here in the Commonwealth. First, the point is that while the overall rates are increasing across the country, they're predominantly driven by increases in a few hotspots, as I mentioned, including New England. This is largely due to a greater spread of variants. They're not new, but of variants that are more transmissible, and they are likely present with higher viral loads in people that have the virus, and the viral loads persist and can be infectious for more days. This includes the UK variant B117, also includes a variant P1 and some others. And what it means is that we just must stay committed to all the efforts that we already know can limit the spread. Masking, distancing, hand hygiene, and so forth. And secondly, the data trends tell me that vaccination works. Vaccination is really our hope to staving off a third surge of hospitalized cases and deaths here in Massachusetts. We are seeing the positive impact of that because the people over the age of 65 have much higher vaccination rates. We're seeing infections occurring in younger people. Even though rates are increasing, we're not seeing hospitalizations or deaths increasing, or at least not at the same rate. So without vaccination, it's very clear that this situation today would be a lot worse. But we also need to be mindful that even those people that have been fully vaccinated, and they may return to certain activities which are endorsed by the CDC, like gathering with other people that are fully vaccinated, and beginning to think about seeing lower risk people who may not be vaccinated, we must be mindful that we still are in a situation where only a minority of people are vaccinated. And so everyone shouldn't return to the activities that they had before, but they must be mindful of their own vaccination status because there is still virus that's spreading. That's evidenced by the number of communities across Massachusetts that are now in the high-risk area. There were up to now 55 in the red across the Commonwealth, including Springfield, Ludlow, Chicopee, Granby, and some smaller towns around us like Ware, Palmer, Munson, and Hamden. And we're seeing the trends play out in our local hospitals as well. At Mercy Medical Center, our number of hospitalized patients with COVID has been steady. It has not continued to go down. As of this morning, we are at 13 hospitalized patients. We have 3 in intensive care. That represents a flat line from last week. But our test positivity rate is remaining stubbornly high at about 5%. Across the Bay State Health System, there are currently 81 inpatients with COVID, which includes 68 at the Springfield campus and 13 in the other community hospitals. There are 13 patients in critical care. This is an increase of about 60% from 2 weeks ago, but only 20% from last week. And so the rate of rise is slowing somewhat. Throughout Bay State Health, the outpatient test positivity is 3.6%, which is down slightly more than 1% from last week, which is a good sign. So with all the trends taken together, it's clearly not the time to relax, your individual efforts to stay safe. The good news, where the hope comes from, is that the vaccination effort has been picking up its pace. There were more than 4 million vaccines administered across the country in one of the days this past week, and the average over the past week was more than 3 million per day. That means that all adults with that pace could be fully vaccinated by the end of June. According to the CDC, there's been more than 165 million vaccines administered to date, and more than 61 million people are fully vaccinated. 40% of the adult population has received 1 vaccine, and 23% are fully vaccinated. But 75% of the population over the age of 65 has received 1 vaccine, and 55% are fully vaccinated. And that's a very, very key statistic when we think about those that are most vulnerable. In Massachusetts, over 3.9 million doses have been administered, and nearly 1.5 million people have been fully vaccinated, which is about 27% of the adult population. So progress, and Massachusetts is among a few states that are leading the way in terms of its vaccine efforts. But even so, 27% of the adult population, which is about 21% of the total population, means that we still have several more months to go. The state is vaccinating more people on average. It's now about 64,000 per day over the last 7 days, according to the report from last Thursday. And the allocations at the hospitals have not changed. At Mercy Medical Center, we continue to be allocated and provide about 1,100 vaccinations per week. We are utilizing Pfizer. And to date, we've provided over 13,500 vaccines, with more than 5,800 people being fully vaccinated at our clinic. At Bay State, Dr. Kerouac reports that their allocations have also remained steady at 4,500 per week, which allows Bay State Health to administer about 900 vaccines a day of either Moderna or Pfizer. And they continue to allocate doses from their own weekly allotment to their sites here in the Springfield area, as well as Greenfield. In terms of vaccine news, there was quite a number of updates over the past week, and most of it was good news. First, it's notable the CDC released a report in one of their MMWRs that showed the effectiveness of the mRNA vaccines, in this case, in reducing the transmission of the coronavirus by as much as 90%. Now, we already knew that the vaccines were highly effective in reducing symptomatic disease and severe disease, and nearly universally preventing hospitalizations. That was the endpoint in the clinical trials. We had posited and had reason to believe that these vaccines would also reduce asymptomatic disease and transmission, but we needed studies after people had received vaccination and could be followed for months at a time to see if that was the case. Well, this report, which documented studies that followed healthcare workers, essential workers, and first responders did just that. There are now more and more studies that are showing that the vaccine does reduce asymptomatic disease and transmission. These are some of the most effective vaccines that we have for any condition. They're not 100% effective, but they are some of the most effective and look to be 90% or in some cases even greater. In addition, Pfizer also released data last week that showed that their vaccine is likely quite safe and very effective for adolescents between the ages of 12 to 15. As you know, their vaccine was already authorized for individuals aged 16 and older. And in looking in several thousand younger adolescents, the vaccine showed no significant safety concerns and prevented all of the coronavirus infections amongst the group that received the vaccine. And so in that early data, that showed 100% effectiveness in that group. Moderna is also studying their vaccines in younger individuals, including some infants. So while none of these data are yet to be presented to the FDA, I think it is reasonable to think that we may have some expanded age groups for vaccination as we approach the fall. There was some news regarding a manufacturing mishap in a facility that was making one of the ingredients of the Janssen vaccine. But with the information that we have, it does not appear that that would impact the overall supply in the United States in order to meet the targets to have enough doses for all adults by the end of May. Here in Massachusetts, today, eligibility for vaccination expands to include all adults aged 55 and older, as well as anyone 16 and older with one qualifying medical condition. Of particular note, both the CDC and the Massachusetts Department of Public Health revised their lists of qualifying conditions over the past week to include additional illnesses or diseases that would prioritize somebody in this group. And that includes now, in addition to the others, more types of chronic lung disease, dementia and neurological conditions, type 1 diabetes now in addition to type 2, HIV, liver disease, having a BMI or body mass index of 25 or greater, having sickle cell disease or thalassemia, having a prior history of smoking, having had a stroke, and anyone with a substance use disorder. These conditions, in addition to the others that were already prioritized, like cancer, chronic lung, heart, or kidney disease, or pregnancy, are now all prioritized for vaccination due to their risk of complications. So as eligibility expands today, and as we expect all individuals aged 16 and older to be eligible in 2 weeks on April 19th, and as the supply of vaccine increases, I want to state very clearly my strong recommendation for vaccination for all adults, regardless of age, condition, or history of prior infection. The recovery of our country and our community remains at stake. The vaccines that we have are incredibly safe. They are some of the most effective vaccines that modern science has ever seen. And this really is a matter of doing what's right for yourself, for other people, and the greater common good. A year into this, far too many people have lost their lives, far too many people have lost their jobs, and far too many people have struggled with depression, anxiety, and isolation as a result of a fear of contracting an illness. It's not only about us and our individual health, it's about the most vulnerable amongst us, including those in other places of the world, as they are the ones that will suffer the most. It's only when we can stop the spread of the virus in all countries, or protect ourselves to a large enough degree that the virus is a glimmer of what it was, that we'll have the ability to fully emerge. So today I urge you all to continue to push on. We have a few more months to go in this marathon. We have the tools and the training to get through it. We must keep our mindset strong and support each other to getting to the finish line. Stay safe, remain vigilant, and sign up for vaccination as soon as you are eligible. Thank you.
Thank you, Dr. Lewis. I know Dr. Lewis with Western Mass News and make the rest of 22. Mike, Eric, and Paul. Matt, any questions or comments of Dr. Lewis? Again, he's doing double duty for Dr. Caraway. So, Audrey?
I wanted to ask about the president's concerns as to like other states with respect to allowing 16-year-olds, 40-year-olds, essentially the rest of the adult population to get the vaccine. Because so many of these cases of people that are among young people, do you have any concern or any beliefs to say that those that maybe have to lose that data?
So the question really is about the speed of increasing the access of eligibility and whether that presents any concerns. And, you know, for me personally, I think that there's it's a very appropriate time schedule based on the supply that's being received. It makes sense to me, I think, from a equity standpoint, from a social responsibility standpoint, and from a medical standpoint to continue down the pathway of protecting those that are most vulnerable first, with limited supply. If supply was infinite, then we would expand, eligibility, and I would push for that immediately. But with limited supply, protecting the most vulnerable first and increasing access accordingly, I think is a very logical way to do it. If there's more vaccine that could be administered, or there were gaps in empty appointments, well then immediately we should increase the categories of people that are eligible and able to be vaccinated. Right now, the predominant infections are amongst younger people, and we know that we need to vaccinate younger people to fully stop and stem the spread. But right now, I think the focus is appropriate.
Any other questions? Audrey, go ahead. Go ahead, Audrey. You have another question? Yeah. Go ahead.
Yeah, I think variants continue to be something that we need to watch closely. I don't have any specific concern or enough information on that variant to know what the concern might be in terms of time of infectiousness or severity of illness. But I think one of the hallmarks of us having an appropriate public health response is to continue to monitor for these variants, gather the science, and then make decisions based on that information. So at this point, it's too early to tell for that, but my approach all along with variants has been to ensure that we are monitoring them, be cautious, but not to overreact, and continue to escalate vaccination, which at this point still continues to show good effectiveness even against many of the variants circulating in the United States.
Matt, you have a question?
Last week, I know that I remember you had said that it was currently in your hospital, Dr. Carroll, about some patients being able to go there. There was a report from Ontario recently about how they're seeing some people are being sicker, that their overall hospitalizations aren't going up, but their admissions to the ICU are going up, as a percentage of overall. I'm just curious if you've been observing it all in the last few weeks that people who are coming to the hospital are more ill than they were beforehand, or if that just hasn't been happening at all.
That has not been our experience. I mean, when the pandemic first started, the patients that were presenting were quite ill, and our ICUs, as you know, were filling up with patients that either needed mechanical ventilation or quite a lot of intervention. Over the past month or so, our ICU has been treating anywhere from 1 to 3 patients with COVID at any given time, which is much less than it was at other points in other surges. I could see where that might happen in some cases if there are younger people who may think that they're not going to get a severe infection and could delay evaluation or treatment until severe symptoms develop. But right now, that has not overall been the main part of our experience in the last few weeks.
And has there been any
So a comment on a couple of things. So early on in the pandemic, we did not have as many treatments available to us. As you know, later in the pandemic, we had monoclonal antibody treatment get authorized for use. And while that maybe has not been widely utilized in many, many patients, both Bay State Health and Trinity Health of New England do have centers where patients who are at risk of hospitalization but do not need inpatient care can receive therapy with a monoclonal antibody, which could, provide them with some treatment and ideally prevent any further complications. Other than that, when somebody, needs a certain level of intervention, they're still recommended they're going to come into the hospital. But if there are patients that are sort of on the borderline, just like with many conditions, we do have robust, home care, visiting nurse services, and a variety of other, supportive wraparound care that can monitor oxygen levels, provide oxygen in the home, and connect people to providers for further treatment. And in some cases, whether somebody was admitted for a short time and then they transition home and they continue to be monitored in that way, or there can be cases where they come into the emergency department or see their doctor in the office and they can initiate those treatments prior to being admitted, we will use that. And that is something that I think our teams are more comfortable with now than they were a year ago. And we'll make the determination on admission based on the clinical criteria of that particular patient at that time.
And just one final question on that. Is it for age group that younger patients are to have overall shorter stays in the hospital itself?
I think you can extrapolate that people that are younger or have less comorbid medical conditions on average will have better outcomes, and that typically would result in, if they are admitted, in shorter stays, less intensive interventions. That does not mean that we have not seen young people succumb to this disease and die from COVID or have prolonged courses. We certainly have. We have seen young people, some with, many, I would say most with, but some with very few comorbid conditions or chronic medical illnesses that have had severe cases. So it is certainly not always black and white, but on average, healthier people tend to recover a bit faster or a bit more frequently than those that have other conditions.
Mike, Nick, Paul, any other questions after you? Thank you, man. So much.
Thanks, everyone.
Stay healthy, you and your family. Mercy. Thank you, Dr. Roos, and appreciate your efforts, and thanks for the update for Dr. Kerouac. We'll now bring up the Commissioner of Health and Human Services, Helen Carlton-Harris, for her update.
Thank you. Thank you, Mayor. I appreciate, as always, your support. The update for April 5th, 2021, currently, as the Mayor has indicated, we are at 19,815 positive cases. The cases by day: Sunday was 34, Monday 41, Tuesday 82, Wednesday 120, Thursday 71, Friday 40, Saturday 98, for a total of 486 cases. That is 60 cases less than last week. The cases by age: 0 to 10, 74, 11 to 20, 79, 21 to 30, 105, 31 to 40, 74, 41 to 50, 51, 51 to 60, 58, 61 to 70, 30, 71 to 80, 13, 81 to 92, 91 to 100, 0. Cases by zip code: 01, there were 2, which is 0%. 03, 12, 3%. 04, 82, 17%. 05, 31, 6%. 07, 25, 5%. 08, 74, 15%. 09, 106, 22%. 18, 45, 9%. 19, 42, 9%. 28, 5, 1%. 29, 24, 5%. 5138, 8%. The cases in the last 6 weeks, February 21st was 414, February 28th, 391, March 7th, 326, March 14th, 310, March 21st, 546, March 28th, which is today's update, is 486. And again, that's 60 less cases than last week. Cases by age group. It should be no secret, nationally, locally, in the city of Springfield, that the 30 and under age group is constituting the highest rate of positive cases. 30 and under, 53% of the cases. 31 to 50, 26% of the cases. Those two numbers together equal 79% of the cases last week in the city of Springfield were under the age of 50. 51 and older, 21%. Cases by race last week, white was 32%, Black, African American, 23%, Latinx, 21%, unknown, 23%, and Asian, 1%. Currently, April's line graph is showing 209 cases. In March, we had 1,771 cases. In February, that was 2,170. 399 cases less in March than in February. The vaccine distribution, the city of Springfield currently through the Department of Health and Human Services and our partners have vaccinated almost 5,000 individuals, and we continue to stand up clinics. As the mayor indicated, I, along with Patrick Sullivan, are looking at other buildings and in the city, in other neighborhoods where we can stand up clinics. We believe very strongly that neighborhood clinics are the way to get our population vaccinated. So I want to start by saying thank you to our vaccination partners, Behavioral Health Network, Curative, Springfield Public Schools. We have also given J&J vaccine to Curative and to Behavioral Health Network. If you go to the city's website, under Behavioral Health Network, you will see J&J, and you can sign up for a dose of the one vaccine. Curative, we have transferred 500 doses to them. They will be doing a neighborhood clinic, which is going to be at Home City Housing on the corner of Bay and Oak Grove Avenue. It has been going extremely well. They are vaccinating 100 individuals each day. They are not using an appointment system. They have cards that they are giving to the neighborhood, to individuals, and they can walk in with their card and get vaccinated. I am extremely appreciative of our vaccine partners. Our neighborhood sites, the Ray Jordan Center, will be on Thursday from 9 to 1. We are going to pilot our first evening clinic this Tuesday from 3 to 8. Right now, those appointments are going well. That may be a clinic that we stand up every week if the utilization rate is where we believe it needs to be, and that the public, Springfield, wants that site an evening opportunity. We have completed a space agreement with Bay State Medical Center. That just got signed on Friday. They have allowed us to use their building at Mason Square Health Center and Brightwood Health Center. However, we will need to staff it and bring supplies. They are very clear that we can use the building, but we would need to make sure that we had all of our systems in place to adequately distribute the vaccine. That will not start this week. Bay State needs that site, Mason Square. They're doing the second round of Springfield Housing Authority, and so we will not start that partnership, but that is a neighborhood partnership that we look forward to completing. VaxForce is extremely active. There will be an announcement about an Interfaith Vaccination Day or 2 days. The research committee has the data from the town hall where individuals answered questions. They are working on that. The education committee is reaching out to institutions of higher learning and our school systems. Operation is working with us to make sure that we are getting students in to sign up for those vaccination clinic opportunities. As the mayor indicated to you, we lost 7 of our Springfield residents. This data is from March 12th to March 18th. I expect that there will be more, but these individuals passed away during that week. There were 2 Black individuals, an 83-year-old male. There was a 79-year-old male who was Black. 4 individuals from the Hispanic community, a 69-year-old male, a 95-year-old male, a 59-year-old male, a 59-year-old female. We also had 1 white individual who was 39 years old, was a male. Again, our prayers and hearts go out to their families. We realize that no matter how old an individual is, when there's a gap in your family unit, it's very painful, and again, you have our condolences. AMR tested 171,066 residents overall in the Western region. 15,826 of them were positive. 75,325 were Springfield residents. Again, we thank AMR for their partnership. They are also our vaccine partners and are really outstanding. When we ask to stand up a clinic, they are there with us, and we are appreciative again of AMR. During the month of April, we usually celebrate Public Health Month. Last year, we weren't able to celebrate Public Health Month in the way that we usually do because of the pandemic. Again, this year, we've had to shutter our plans to celebrate Public Health Month. But during the month of April and throughout the years, agencies, advocates, and residents observe and participate in healthy living guidelines, healthy eating, healthy movement, healthy personal intra and inter relationships, stress avoidance, and increased knowledge about health based on science, which leads to good health outcomes. And so this year, we know that we are in a very different place. And I have decided that the theme for Springfield will be Somebody Needs You, Public Health in a Changing Environment. And when I say someone needs you, I'm really talking about the mitigation and prevention efforts that we must put in place in order to get through this very difficult time for us. You have been, as a public, told many times, you have been advised by the best public health experts in the world to not let your guard down. Dr. Ruth spent time really trying to motivate us around the mitigation efforts, prevention efforts, intervention efforts that we should do as the public. All of us have COVID fatigue and are tired. We have been dealing with this virus for over a year, and I understand why the weather and other things in your life or celebrations in your life might make you want to get out be with individuals, be in an environment where you can be close to people. Now is not the time. Now is the time to continue to wear your mask, wash your hands, and watch your distance. Vaccinations are safe. Vaccinations are something that I believe each one of us need to consider. The vaccination effort, as Dr. Roos told you, has opened up to 55 and over, individuals of any age with one comorbidity. So there is vaccine opportunity for you to be able to keep yourself and your family safe. And so we are not powerless individuals. We are individuals with power, and that power comes from taking back our lives by doing the things that are necessary to get us back on track. I ask you one more time, as I have for over a year, use that power to be safe, use that power to take care of your families, use your power to prevent, mitigate, and save lives. Thank you.
Thank you very much, Commissioner Helen Colton-Harris. And again, we are both deeply appreciative of everybody's patience and cooperation, understanding. I know it's frustrating. I know you're fatigued, but we need you to hang in there. And it cannot be lax. It cannot be lax, especially our younger people. Starting to see more and more not wearing masks. We'll now move to the public safety segment of the COVID-19 City Hospital update. And I'll bring up the Fire Commissioner of the City of Springfield, Bernard B.J. Calvin.
Thank you, Mayor. Good morning, everybody. Springfield Fire Department this week, we have no one out due to COVID infection, so that's great news for us. Due to the hard work of everybody involved, I'd like to congratulate all the members for being able to keep the infection level down to low numbers in the department. As the mayor said, we had a quiet weekend. We did have a big fire Thursday night on Lexington Street. One firefighter was injured when he fell off a ladder. He's doing well. He's out of the hospital and hopes to return to duty soon. Other than that, I don't have anything to report this week. Thank you very much.
Thank you, Commissioner Calvi. I will now get the report from the Springfield Police Department. The Springfield Police Commissioner, Cheryl Clapper.
Thank you, Mayor. The police department is down 8, and I believe that the 8 were included in last week's count. They're just still out sick. One includes a new officer. We did have a wonderful graduation and promotional ceremony on Good Friday. I'd like to thank Patrick Sullivan and Amanda from Symphony Hall. What a beautiful venue. And they enabled us to be able to have 2 ceremonies there. And everybody commented on how beautiful Symphony Hall looks, so thank you everybody involved in that. It was a fairly decent weekend. We only recovered 1 handgun, that was on a domestic. We will continue with the dirt bike preventive strike this week. I know their plans are for the nice days of coming up for this week. On behalf of the Springfield Police Department, our thoughts and prayers are certainly with Tom Ash and his family during this time. And also on behalf of the Springfield Police Department, our thoughts and prayers to DC Police, Capitol Police, William Billy Evans. Our thoughts are with him and his family and with the recovering officer. God knows Capitol Police have had their share of heartbreak, so we're thinking of them for sure. I thought he looked familiar when I saw Billy Evans' photo, and I did have him as a student in 2001 when I was an adjunct professor at Western New England University, so his smile looked familiar to me. So certainly our thoughts and prayers are with the Capitol Police during this time. Thank you, Mr. Mayor.
Thank you, Commissioner. I'll also bring up William Billy Evans. Shows how dangerous police work is, and God rest his soul, and sympathy, thoughts, and prayers to his family and friends and colleagues. With that, we'll now move for an update from our Springfield Public Schools and Superintendent Dan Warwick. A lot of exciting things going on, and we have just opened up hybrid. So again, it was good to see the school buses out there and good to see crossing guards. Superintendent of Schools Dan Warwick.
Thank you, Mayor. Good morning, everyone. On Friday morning, I found out that, in working with our bus company, that we had some unexpected problems with staffing relative to our buses. But working over the weekend, we were able to reroute the buses and get it all resolved. And we had a very smooth start. First Student has been a great provider for the city of Springfield. They've done a good job over the years, and they really stepped up to the plate. And this was a very complicated busing scenario with a hybrid situation and the routing anyway. So I was thrilled we were able to get that resolved. We did warn our families there could be little scheduling snafus. And quite frankly, on the first day of school, very often there are little scheduling snafus. The drivers running the routes for the first time. Part of the scenario with the bus company is with their union, the drivers get to bid the routes every year. So they had to go through that bidding process. And it was through that bidding process we had the unanticipated shortage of drivers. Up to that point, they had told us that we thought we had a full complement of drivers to handle everything. So we were able to work through it, and I was thrilled with that today. We're thrilled we have our kids back in school. We had a very good start, and thanks to the hard work of many folks here today on the mayor's staff, thanks to all the support from our mayor, who was incredible in providing the resources. And, we just thrilled to have our kids back in school. We're continuing our meals program, even with the kids back in school, but we've gone from 18 sites to 11 sites, and we're going to serve 4 to 6 in the evening so we don't conflict with the children arriving and departing from schools. So those sites are on our website, and to date, since we closed down, and it was a little more than a year ago, it was on March 12th, we've served 6,920,409 meals. So an incredible effort by our lunch partner, Sodexo, and my team of Pat Roach and Tim Gray working with them and executing this. I'm just very, very grateful. Food insecurity is a problem in our country, and it's certainly a problem in Springfield, and our folks have done a great job in meeting the needs of our families. And again, the reopening today, just to reiterate the grades, it's pre-K to grade 6, and then our high needs special ed, SLIFE ELL students, the kids with interrupted learning, and our vocational students in grades 10 to 12 at Putnam. So they would have started back today. Our high needs sped, SLIFE, and vocational are 5 days a week, and our pre-K to 6 were in a hybrid scenario. So Monday, Tuesday, and every other Wednesday and Thursday, Friday. So the groups were split up weekly like that. Our next phase, starting on April 26th, we'll be bringing our grades 7 and 8 in. And then the kids who came in this first phase, the elementary kids, pre-K to 5, will go full on 5-3, and then the middle school kids will go full 5 days on 5-10. High school, we don't have a return date from the commissioner yet. We are anticipating that shortly, but he hasn't issued that date yet. I agree with the commissioner on this. The high schools, when you bring them in a remote program, you can't have the kids go from class to class like you normally do. So it won't be a typical high school program. It'll almost be more like remote from the school. And so we're taking our time with that, working with the commissioner and see what he puts out on that. But it makes sense to bring those kids in last. MCAS, we did get something, and I know some of the media outlets covered it, but we were thrilled for our 11th graders that they don't have to take MCAS for their CD for graduation. So that's a relief for those families with the interrupted learning that just didn't make any sense, and that is not a federal requirement. So the commissioner pulled that. And since in Springfield, grades 3 to 8, 50% of the parents chose remote, and we're going to continue to service those kids remotely. Those students can now take the MCAS remotely. So that's another big change, and we have the technology to execute that. So again, I think a big relief for those parents. It just doesn't make sense to give a test to tell us there's been interrupted learning during a pandemic. So I was thrilled for that relief. It wasn't everything we wanted, but we were grateful for that. Spring sports are approved, and our health commissioner, Helen Carlton-Harris, has just been a godsend on this, because those extracurriculars are so important for our kids, and we've been able to keep it going with her abundance of caution doing the 3 tests. And due to that abundance of caution, we caught it early with our fall 2 season, our football, and we're undergoing testing now to see if we can get that going again, but due to some positive tests, we had to shut down. But we're retesting and seeing if we can get that going again. But very grateful to our health commissioner, who has been really part of our team since we started with this pandemic. On the building front, I just wanted to thank Pat Sullivan again from Facilities and the mayor. You know, $1.4 million into our buildings to upgrade all of our ventilation systems, and due to that, we're having a great start. You know, when you have an average age of 55 years old with your schools, and you know, 58 different schools, you have various kinds of ventilation systems. But we upgraded all those systems to exceed the DESI standards and go to ASHRAE standards. Excuse me. So I'm very, very grateful for that, because our student and staff safety is very important to us. And lastly, again, with the support of the mayor, we put millions into technology, and having the extra laptop for the teachers to execute the hybrid and remote, and the DocuCam, and I think we saw it when we did the press conference last week at Johnson. Our teachers are ready to go today to continue to give our kids who are staying remote a quality program, but our kids that are coming back hybrid or full to offer them a quality program. So again, with the support of our mayor, we're ready to go, and we're excited to have our kids back in. Thank you.
Thank you, Superintendent Warwick. We'll now get the update from the Department of Public Works and Director Chris Signoli.
Mayor, thank you. As far as the DPW, we have 1 employee down with COVID. Our yard waste started last week, so on your recycling day, please make sure you have your yard waste out. Full construction activity started last week, so they will be going on, obviously, starting last week and moving through, and with the buses that are out there, expect to see a lot more traffic. Street sweeping has been going on. Please check our Facebook page as we put an update out every week to show where we will be over the next few weeks. As the mayor mentioned, 311 for potholes or any other issues related to our roadway system. Just a note, permits. If you as a resident or business are doing work around the city and you're going to be working in the public way, you or your contractor needs a permit. We've spent the last couple weeks going around trying to make sure everybody's aware of it. And the last thing that we are also doing is following the infrastructure bill at the federal level. Our key point on that is just trying to find out how the money is going to be kind of funneled downward from the federal government to the state and hopefully to the municipality. For those of you who remember the ARRA back in 2008 and 9 with the Obama administration, not much came down to municipalities. It was all eaten up at the state level. So we're trying to make sure that that doesn't happen again this time. And that is it with regard to the DPW. Thank you, Mayor.
Thank you, Director Signoli. We'll now get an update from Facilities and Parks Director Patrick Sullivan.
Thank you, Mayor. We have 0 out with COVID. As the superintendent stated, we are continuing to do well with the school openings. I want to thank our Commissioner of Health and Human Services, Helen Carlton Harris, Superintendent Warwick, our trade staff, and our industrial hygienist during the last few months. I think we've all done a great job, and it's great to see the kids going back to school today. On the park side, we're in the final stages of our COVID guidance. After reviewing the Commonwealth's plan, we're going to be working with the Health and Human Service Department to go through the plan and follow up. And if you have an event that you would like to hold in the park, the contact number is 787-6434. And as stated last week, the Barney Carriage House is open for up to 150 guests. That number is 787-7733. And then at the mayor's request, we're reviewing the Commonwealth summer guidance plans. And in preparation of the summer for openings, we are preparing a lifeguard training course. That will be April 20th through the 23rd. Anyone interested in attending that should call 787-6298. Thank you.
Thank you, Director Sullivan. And finally, again, Springfield's in the business of doing business, and the Chief Development Officer, Tim Sheehan, appreciate his efforts. We'll be giving you an update pertaining to economic development.
Thanks, Mayor. Last Friday's job report was stellar. Jobs created were strong across all sectors and were clustered in some very high-paying industries, with 183,000 in construction, 110,000 in manufacturing, 53,000 in government, 136,000 in education, and 101,000 in healthcare. If you looked at adding back in the 156,000 back revisions over the past 2 months, the report had over 1 million jobs. The economy is turbocharged with the fiscal stimulus and vaccine rollouts becoming more efficient. If we can stick the landing on vaccines and resuscitating the labor market, that gives the country the opportunity to engage in transformational projects such as infrastructure. We still have work to do. We have 8.5 million jobs left to restore, but there's a lot of momentum right now. The Urban Institute analysis for Springfield with regards to low and moderate income jobs that have been lost, that number is 19,000. The breakout of that, there were 8,000 in hospitality and food service, 3,000 in healthcare and social assistance, 2,000 in educational services. As the city, we must continue to fight to get these jobs back online and the low and moderate income workers back into those jobs, and continue to provide workforce training to improve low and moderate income workers' economics and those of their families overall. Small Business Technical Assistance RFP, as the mayor indicated, was posted last week and it has a closing date of 4/21. We did have a very good meeting with regards to the progress associated with 31 Elm Street. And as the mayor indicated, there is a pretty big initiative that's both public and private sector across the largest institutions, both regionally and locally. It's the Anchor Collaborative, and put it in its most simplest form, those institutions are looking to hire locally and buy locally. The initial work of the Anchor institution will be focused on Springfield and eventually expand out to Chicopee, Holyoke, and Northampton. And that's it for me this week.
Thank you, Director Sheehan. Received a financial update by CFO, TJ Plant, and legal, HR, and labor. I gave you with Solicitor Pakula and Attorney Bill Mahoney. So at this point in time, if you have any questions or comments, we'll take them at this point in time. Audrey. Sure, Commissioner Colton Harris.
So the new eligibility is, as you know, 55 and older, and individuals of any age with one comorbidity. It is my hope that opening up the vaccine process to more Springfield residents will allow more individuals to get vaccinated and then help us to move past this crisis.
With respect to the health conditions that were added, though, like, are there any that weren't on the list before, the provisions that you're using now will help residents be eligible, with respect to, diabetes, updated, obesity, BMI, qualifications?
The health conditions or the comorbidities that were added, HIV/AIDS, diabetes, obesity, are really very important. We know, as far as the city of Springfield is concerned, that we have many individuals who fit into that category, who we are disproportionately represented in those numbers as a city. So opening that up will allow us to give access to those individuals. But more than that, by calling out those comorbidities, you help people see themselves in wanting to get vaccinated, because they understand that we are really talking about you. You are now eligible. So I'm appreciative of the governor and DPH in just listing them in a way that people can respond to.
And one follow-up, you mentioned it before, would you mind saying which locations in Springfield Dr. Johnson
Which locations, what?
Dr. Johnson?
Yes, I'm happy to do that. So Behavioral Health Network, if you go to the city's website, it is there. There are appointments available, and I believe it's on the 9th where they're going to have that first clinic. Curative has 500 doses. They will be dosing 100 individuals a day with the Curative vaccine. I think what's going to be interesting is to see how many of our residents are interested in J&J or Jensen. There has been some resistance in the community to that vaccine, and that was based on the earlier efficacy rate, where people thought this was less effective or Jensen was less effective. So it'll be interesting for us to see really how many of our residents take advantage of that. We knew that congregate care settings wanted that vaccine, the one and done, so that their residents, they didn't have to look for them for the second vaccine. So it'll be interesting to look at the data once we have it from this week's vaccines clinics.
Commissioner, just stay up there, sorry. Both you and the mayor alluded to an interfaith vaccination program or vaccination clinic that you've got. Can you elaborate a little bit about that? Maybe also talk about how important you see the faith-based institutions in promoting vaccinations in Springfield?
So VaxForce, the committee that the mayor has stood up, has a Interfaith Committee. That committee is working together with houses of worship across the city of Springfield. Although I anticipate we're going to have that clinic at St. John's Congregational Church, because it's in the middle of the city and they are set up to be able to host it. But it will be pastors from the north end. It'll be pastors from faiths who are interested in making sure that their parishioners are vaccinated. When we did the data and we asked, who is your most trusted voice as far as vaccine is concerned, we gave a list of individuals. We gave faith leaders, medical leaders, public health leaders. In every poll, faith came out number one. So it appears to us that people are willing to trust their faith leaders, and so we will come together with houses of worship across the city and have one day or 2 days, we may have to do 2, where we are vaccinating the parishioners or anyone who wants to participate in that event.
Just to clarify something you said in your presentation, I wrote the number down to 5,000. The city has administered about 5,000 doses through the neighborhood clinics.
That's correct.
Okay, thank you.
Just a quick question for you as well. I was just curious, something that I've seen in terms of when I asked about long-term planning. I know that Philadelphia had like a Is that something that your department is also looking at, maybe further down the road when there is more vaccine in the city anywhere?
We are actually doing that now with Curative. And so the walk-up, the individual must have a card or should have a card, but they are able to walk in and not have to go to an electronic sign-through process. So we are supporting the initiative that Curative is doing, and they do have J&J vaccine this week as well as Behavioral Health Network.
Do you expect that to be something the city wants to expand over the course of time because of obviously the flexibility that it entails?
The city of Springfield will do whatever it takes to be able to get individuals in our city vaccinated. And walk up or walk through is something that is highly utilized in other parts of the country. And certainly we will deploy that strategy along with our partners in order to make sure we're reaching all of our residents who want to be vaccinated. I said that to say the answer is yes.
Thank you.
You're welcome.
Excellent. That's our goal. I mean, we have to make sure the logistics are all in place, and the clinics Helen has done with teams have gone very, very smoothly. And she's correct, Paul. When the Vax Force, the subcommittee of the Interfaith, the religious committee, trust, and we're trying to deal with the apprehension of some communities or individuals that want to take the vaccine. The trust factor was number one when it came to their faith leaders. So Helen, especially Helen and I, we base our decision on facts and statistics, where to go immediately. And if we keep getting, and I'm sure we'll keep getting vaccines from Governor Baker, that'll be our strategy. Any other questions or comments? Yep. Sure. Tim.
So I was curious, I think we talked before about like there's already been money some spent on workforce development, thinking about jobs that aren't necessarily going to come back after the pandemic. Are there any in particular in Springfield that you're eyeing specifically classes of people that you think that really are going to need to be trained, the jobs aren't going to be coming back when all it was that's on your mind in particular?
Well, I think the workforce is going to change dramatically after this, and I think we need to be preparing people to deal with those changes in the new economy coming forward. And, you know, I've said it on multiple different occasions at the podium, looking at the economy, whether it be local, state, or national, having more inclusion in the economy and providing more opportunity to people to actually improve their economic conditions. I think workforce training is one of the fundamental components of that.
Any other questions or comments? Okay, hearing none, again, thank you to the media and the TV, radio, and print for keep getting the word out. Thank you to the residents and business community for your continued patience and cooperation and understanding. But don't get me wrong, I appreciate that, but I know there's a sense of fatigue and people are starting to become a little bit laxed. We need you to hang in there a little bit longer and take the COVID-19 guidance and public health guidance regulations to heart, and wear those masks and wash your hands, stay socially, physically distant, and if you don't feel well, stay home. You have the opportunity to get the vaccine, please get the vaccine. It is safe and sound, and it'll be advantageous to you and your family. And we continue the balancing act of making decisions on public health and economic development activities. Once we do, and we will defeat this COVID-19, that's the key to bringing back full public, consumer, and business confidence moving forward. So with that, I wish you a good and healthy day, and go out and have a great day. God bless. Thank you very much.